Hello, my name is Troy Bolden, and I'm a student nurse at Cedar Crest College, and today I'm presenting to you my critique on the effects of music therapy on anxiety of patients with breast cancer after a radical mastectomy, which was a randomized clinical trial. The study problem and background is that breast cancer is on the rise throughout China, but not only China, but also throughout the world. And with breast cancer comes anxiety. And anxiety is the greatest psychological symptoms that most breast cancer patients face. And with a radical mastectomy, there's an increased chance to develop some kind of anxiety or stress. The problem significance, anxiety and stress can lead to a multitude of things. They can hinder the healing process of a patient after a radical mastectomy. So, after this very invasive surgery, you want your patient to heal the best way that they can. So this increases recovery time, but can also lead to other psychological, psychosocial, and physiological problems like depression, isolation, nausea, vomiting, and other symptoms that may come with high levels of anxiety. And also what the researchers wanted to do was develop some kind of therapy that was less invasive and led to less signs and symptoms, especially since these patients were going through chemotherapy, radiation therapy, and other kinds of very aggressive therapy forms. The purpose of the study was to evaluate the effects of music therapy on patients after a radical mastectomy for their breast cancer. And the authors actually hypothesized two things: that music therapy would have a great effect on reducing the anxiety of these patients, and that the treatment and follow-up time had great correlations. So introducing music therapy to these patients post-mastectomy on day 1 as opposed to day 7 would greatly help reduce their anxiety. The design of the study, the framework was based on a model that was developed by Lydia E. Hall called the Cure, Care, and Cure model. So at the core would be the patient with breast cancer post-radical mastectomy. The care would be those nursing interventions that were used along with the music therapy, and the cure would hopefully be the reduction in that anxiety that the patients were experiencing. It was a randomized controlled clinical trial, and the control group were those patients who had no access to music therapy whatsoever. The experimental group were those who had access to music therapy post-mastectomy. The independent variable was the music therapy, while the dependent variable was the patients facing anxiety. The sampling method. So the researchers recruited 120 female patients. They had to be between the ages of 25 and 65 and had scheduled a radical mastectomy. They excluded patients who said that they were allergic to sound, had some kind of voice-sensitive epilepsy, or said that they preferred not to listen to music. Of course, the latter would not be a good choice, especially because this was music therapy. So this may have some kind of negative effect on the results. And lastly, they used a computer to randomize and generate these study groups. So the interventions and implementations used. So for the experimental group, these patients were allowed to choose their preferred genre of music to listen to during music therapy. This was a great intervention, as you don't want a patient listening to any kind of music that they don't prefer because it might not have the desired effects. Patients were able to control the volume, and music therapy was done twice a day, once in the morning and then once at night. And the control group had no access whatsoever to music therapy. They were actually given no information about music therapy, and I think this was a good choice because this may have influenced their anxiety state throughout the study. So data collection and analysis. The data was collected using the State Anxiety Inventory, or the SAI. The Chinese equivalent of the SAI was actually used because this took place in an oncology clinic in China. And this SAI was used both pre and post mastectomy, radical mastectomy. And after the radical mastectomy, the SAI was conducted 3 times. And the results were analyzed with a t-test. So the t-test was used to ensure that the measurements of anxiety were comparable between the two groups. The chi-square test was used to statistically determine if the significance between the demographic data had any effects on the results. And the ANCOVA test was used to determine the significance of the results. The Human Research Ethics Committee was the body that ultimately reviewed and improved this process and study and experiment. Participants were given information about this, but again, the control groups received no information about the music therapy because this may have an effect on their results, and the participants ultimately gave their written consent. The limitations of the study: the researchers only collected quantitative data, so they had no subjective data whatsoever. So this may be something to consider in the future. They only focused on the psychological data as well. So they didn't get any kind of feedback from the patients about any kind of physiological symptoms, or if this helped with any of their physiological symptoms. The control group had no music therapy. Of course, this is what a control group is, but they really didn't do any kind of time frame, like I mentioned earlier, on day 1 with music therapy, as opposed to introducing music therapy, on day 7 post-radical mastectomy. And lastly, they only had a small number of patients who went through an extreme radical mastectomy. So in the future, they may want to recruit those patients or more patients who had an extreme radical mastectomy. And the results: music therapy was found to reduce the anxiety of patients. And nursing implications. So along with the core, care, and cure model, using that with music therapy, I think, would be a great nursing intervention. This could be a complementary nursing intervention that nurses can use in a clinical setting, especially if it's generalized and it can be rolled out in China, but also other parts of the world. And the reduced anxiety leads to better patient outcomes. So they may experience lesser or no signs and symptoms. In the conclusion, music therapy is a great way to help reduce anxiety in patients, especially those with breast cancer post-radical mastectomy. And music therapy, along with the core, care, and cure model, can be used and rolled out and generalized, and can be used as a great nursing tool. And then lastly, using music therapy is a great way to help reduce anxiety overall. And these are my references.